Hey everybody, it's Jess DaMassa with What's the Future Health. I am talking to the who's who of health tech and healthcare innovation. And today, oh, look who has dropped in fresh from the New York Stock Exchange. It is the CEO of Signify Health, which just began trading today after their IPO. Please meet Kyle Armbrester. Kyle, congratulations. So happy to have you here.
Yeah, thank you so much. It's a pleasure to be here, and I'm happy to tell you a little bit more about our story today.
Oh my God, I want to hear about the IPO. So priced at 24, went out at 32, $7 billion valuation. Pick it up from there. How are you feeling?
Yeah, I'm feeling great. It's the exchange was a blast. It was really fun. We got to go in person, which was unique. There's a very small group of us, socially distanced with masks. Everything was very safe. They ran an amazing operation there, it was a once in a lifetime moment. And they do a great job. They had an awesome production crew that live streamed us into our entire employee base. We had all the employees on Slack, and so we it's about them, it's about all of us, and it was a huge milestone for the whole organization. And I thought they did a great job of making it very inclusive and bringing everybody together. We had a few employees virtually on the screen helping to ring the bell with us too. So they did a great job, and we couldn't be more happy with the outcome.
All right, so now you got to tell us about the business. Now that we're all kind of sucked into the IPO story. So Signify Health, you guys are disrupting healthcare in two ways, which I think is really interesting. So number one, not only are you disrupting on the payment model side, which is hard enough, so pushing towards value-based care and actually taking value-based care into a new place. I believe you said value-based care 2.0 to me,
Yep.
which we'll dive into in a second. But the other way you guys are disrupting is also pushing the care continuum. So not focusing so much on delivering care facility-based, but pushing care into the home. And then for you guys, this actually backflips into a social determinants of health kind of play. So I want to unpack all of this, but before we do, give us the quick high-level intro to Signify Health and tell us what you guys do.
Yeah, absolutely. I'm happy to do it. You did a pretty good job. So
Hey, thanks.
The most important thing about us is we're a mission-driven organization, and we only get paid. All of our revenue and how we make money is attached to positive patient outcomes and moving the human condition forward, right? That's how we define value-based care. We are not interested in license or maintenance revenue or PMPM revenue. When I said value-based care 2.0, we're divorced from all that. We've moved beyond things that aren't connected to outcomes. And that's super important to how we run the business, how we prioritize our product portfolio, and for the employees that we bring on. So that's the foundation we're built upon. From there, you're right, we do two main things. One, we organize payment, so all the financial incentives, to drive recovery homeward. That's how we define value-based care, right? Happy or healthy days at home with all the healthcare constituents that surround an individual. So the insurance company, the self-insured employer, the provider groups. And we also, number two, bring in our own clinicians, nurses, doctors, and social workers to help activate the home in particular as a place to trigger care, a place to recover, and a place to make sure that we're building out a more sustainable, healthy place for individuals to live. And when we pull all of that together, I think that we're disrupting the facility-centric model that has plagued the United States for too long. Facilities are fantastic. They have a place in the delivery chain, but they're not the end-all, be-all answer. And more than anything, in a nutshell, what we're trying to do is enable our partners who want to be in value-based care to diversify into a bunch of different value-based care programs. And then we execute and expand their access financially and via the continuum to take on larger panels of individuals. And then again, we only get paid when we help successfully cut out excess costs and drive better outcomes. And that's always those two fundamental things that help drive our business forward.
Okay, so this is some deep healthcare stuff. So for those who may not be really familiar with who you would be targeting as a customer for something like this, talk through that. So like who uses Signify's health services today?
Yeah, great question. So we predominantly sell to risk-bearing entities. So we work in managed care organizations, so big Medicare Advantage companies, big managed Medicaid companies, so Humana, Aetna, Anthem, Optum, United, so a lot of the big names, but also big regional players like Priority or Regents, so health plans in general, number one. We also sell and partner to health systems and help them, again, build out those value-based care books. We bring episodes to those health systems. We also help because many of them are starting their own Medicare Advantage plans. And so we're going in and helping to take risk. So we have upside and downside risk in our contracts. And we help bring them into value-based care schemes where they want to help, again, drive better patient outcomes while removing waste from the system. And we operate right in that swim lane.
All right. And now, okay, value-based care, as far as that goes, there are fans, there are super fans, but then there are a lot of skeptics about it. And I think that the thing that I often hear most on the skeptical side is that there hasn't really been a way to scale value-based care in a meaningful way. So do you think that's accurate? Number one, from your vantage point, what are you learning that does prove that it's scalable? I mean, I think the market, valuing you guys at $7 billion is putting a nice bet on the fact that it is. But I mean, just say more about that issue of scalability when it comes to value-based care and how you guys are planning on tackling that.
Yeah, it's a great point, Jessica. And I would say historically, there was a lot of trial and error in the space, and that's great. It attracted a ton of entrepreneurs, and the ball was moved forward substantially. But what's changed in the last 5 years, in my opinion? Number one, you've got data is ubiquitous in the market now, right? Post meaningful use, interop and digital connectivity and access to clinical and claims data, payment data is way more than it was 5-10 years ago. So you've got visibility and you've got information you can trigger and work through. I'd say the federal government gets a lot of credit, pushing transparency, pushing for deeper interoperability, all the work they've done around FHIR APIs, the Argonaut project, all of these things were big, long, multi-year campaigns that are starting to bear fruit in the market. Humana, one of our biggest partners, has a FHIR API built on top of our technology stack to pull medications out, right? It was one of the first times a big health plan partnered with a third party using FHIR. So these standards and all of the hard work and investment that went in for years are starting to bear fruit, I would say, is number one.
Okay.
Number two, costs are out of control. We're spending $4 trillion on healthcare in the United States, and that is outpacing GDP growth, the growth rate. And so not only do you have the Medicare trust potentially in a bad financial shape, but employers can't afford healthcare anymore either. And so their folks are looking for alternatives. They understand there's a lot of waste in the system, but not everybody has the answer. And number three, I think organizations such as ourselves go out and guarantee savings, right? And so when we create an episode, we go to the risk-bearing entity and guarantee them savings off the top. And that's important. They can go take that back to their CFO, put that in the bank, and know that they're actually saving and cutting waste out. And then with our heroic provider groups, we go out and partner with them and share in the savings that we create together. But what's most important, you can't just save money, right? If a bad outcome happens in an episode, if somebody readmits to the hospital or if they get injured again and they need additional care, we lose money right alongside with our partners. If the patient experience deteriorates or if the outcomes deteriorate and costs go back up naturally, we all lose money. And so what we've figured out is, first, economic incentives are important. That's not a novel concept, but we've created the financial transparency and brought in enough data to make that a reality today. But number two, I don't believe in healthcare technology companies alone. I think technology is a critical component, but you have to have a service part if you're going to really roll up your sleeves and make a real impact. And what we do, again, is activate the home as a key part of the care continuum, which is a lower cost setting. And we're proving each and every day is very high quality. I think people get better at home. They've got their dog, they've got their favorite blanket, they've got their comfort food, they know where the remote is, right? Those things matter. And I think that I read a statistic somewhere that depression and stress and anxiety is like the same as smoking 15 cigarettes a day.
Yeah, I've heard that too.
Yeah, I mean, that's a real social clinical condition that we don't talk enough about in this country. And I know about me, like compared to a hospital bed, if I have the option to be at home, it's going to be a lot less stress and a lot less anxiety. And so we're not going to solve all problems through the home, right? Hospitals are absolutely critical. We're always going to need them. I think that we're moving into an era though, Jessica, where Michael Porter wrote years ago about the need to specialize, the jobs to be done, kind of where and what is your main thing that you're good and great at. Hospitals should be there for big, complex, hairy procedures and big chronic conditions that need a lot of management. But I'm not sure they're the best place for wound triage or basic care or ensuring that someone's going through a physical therapy regime, right? And so opening the aperture up to have recovery in the home And being, again, a part of the optionality in that care continuum, we can cut out tremendous waste while also driving better outcomes for individuals. And that, in its essence, is what Signify is targeted doing.
All right. How has COVID just poured jet fuel all over that idea? I mean, truly, like, I'd love to hear about your experience, this past year in terms of, care being forced to move into the home. And then you've had different health systems and provider groups and payers scramble to make sure that they can meet the need that's there. But talk about your experience there and how has this proven out your model even further?
Yeah, it's a great point. And I would say, even in the peak of the pandemic, right, we were able to, we got calls from health plans. We got calls from health systems. They said, look, facilities are shutting down. Some of our members or some of our patients, can't get in. They can't get their prescriptions refilled. They have a whole host of mental health issues. They're depressed. They're scared. We were all scared, right? We need you more than ever to go check on them, go make sure they're okay, make sure that if they do have an urgent problem, we're getting them appropriately triaged through all of the chaos that kind of ensued. And we saw many partners lean in with, big contracts, more home visits, activating and driving more care into the home. But also really important, Jessica, more partners leaning in as a part of those episodes, right? Knowing that value-based care didn't turn away from them like the fee-for-service book did in the middle of the pandemic. And they saw, and it really proved, and we saw many of our health systems say, we are done with fee-for-service. And some of them dramatically expanded total episodic volume with us in the middle of really, really tough times for the systems. And we're proud to partner with them. We're proud to be in the lives of the patients that they are managing, driving, again, better outcomes while sharing in the savings with them, helping them make money to stay viable because we're cutting out waste.
All right, so sharing in the risk, pushing care into lower cost, lower acuity settings like the home. So who competes with you? You can't say you're running unopposed, right? But like, who is doing this in this space? Who do you guys have your eye on in terms of competition?
Yeah, some health systems are competing with us, so they self-convene and create their own episodes. They typically do that in 1 or 2 or 3 service lines. We manage it in 34, so that's the full BPCIA book. Many health systems are doing procedural episodes. We do procedural and chronic condition. So we do maternity, substance abuse, oncology, pain management, diabetes, many of the things that are impairing a self-insured employer or a health plan's ability to proactively manage people in a positive way. And so the competition, it's a little bit of a substitute, I would say, just on the episode side. They have a narrower focus and they go bigger. They typically come partner with Signify, which is why we have tremendous partnerships with some of the biggest, most complex health systems in the country that we're very proud of. On the in-home piece, just to round out, on the in-home piece, some plans do some home visits themselves, and there's some competition and market with smaller companies that are doing home visits as well. I think that we have the best technology. I think that we also offer a more holistic solution. So this is the social determinants component that we round out. But we're also very, very focused, because of the integration of our 2 businesses, of activating people back into their care teams. So 90% of the time we go into a home, we're driving somebody back to their primary care doctor, back to their specialist. We are not their primary care doctor. We are not their specialist. Again, we want to be an amplifying part of the team that expands their and their organization's ability to manage a bigger value-based care panel of patients.
I want you to draw me a line to the social determinants of health stuff, just in case this is not clear to anybody who's watching. So I did a little research on your partnership with Independence Blue Cross.
Yep.
The project is called Community Link. So talk a little bit about this, because I think this, on the real impact of all of the financial stuff that we're talking about here in terms of, sharing in risk, lower acuity settings, all of that stuff, what that actually means is greater access, better outcomes for different types of populations of patients. So say more about the Community Link partnership. Tell us what you guys are learning from this so far.
Yeah, it's a fantastic partnership with one of our most innovative health plans in the country, right? And a partnership we've had for several years. And so it was really simple, right? We were going into the homes of all of these individuals. And when we went in there, we saw all of these social conditions and knew that we could and should, as did IBC, be doing more to help those folks, right? And it was a moral imperative, but importantly also, 60% of readmissions for some individuals are driven by social conditions, right? And so taking a holistic look at those individuals can actually help move the word care from a lowercase c to care to an uppercase C, right? That is genuinely human-centered, that is holistic in nature and is about taking care of somebody with their specific needs in mind, not just a care model, right? Like you can't generalize healthcare. It's way too nuanced, way too specific. And so we're doing things like ensuring they have meal delivery, ensuring that the local carpenters union comes and fixes their steps and prevents falls, ensuring that they have transportation assistance if they need it, but also knowing that they have a granddaughter who has Down syndrome. And so just sending a car isn't going to help, right? You need a caregiver that's going to be there to help contextually and appropriately help take care of that granddaughter so they feel safe and secure when they're leaving the home so they can go get their care. And so we actually compensate. We have two parts of that model. We give our software away for free to the community organizations. We want them to grow. We want them to be a part of the network. They're grant funded and they're doing, God's work, right? It is truly some of the most inspirational work that we see. The second thing we do as a part of our service is we have delegated social workers. Those social workers, they use the phone, they go out in the field, they get compensated on spending more time with people. That sounds like a radical thing, right? Everyone's like, faster, right? Quicker, like how can we get through this? The longer you have these conversations, the more you're finding out about the granddaughter, the more you're finding out it's not just about sending the car and building those connections. It's what our clients trust upon for us. The single most important way that somebody accepts in a visit for us this year, most predictive thing was, did we spend time with them last year? And so we're building these really strong multi-year data-centric relationships because we're going in with all this context and we're bringing solutions to them in a convenient and accessible way, not waiting for healthcare to happen and trying to show up afterwards and pick up the pieces. And that's a pretty novel concept that I'm super proud about and that our employees are very passionate about.
That's very exciting because oftentimes, that's kind of like, nobody knows what happens at home. You can send somebody, you can discharge somebody with the best instructions, the best intentions, the best, tools to maybe support remote monitoring devices, whatever. But a lot of times nobody realizes the setting that's going into. I think that's very powerful that you're able to, not only do that kind of reconnaissance, but also bring that information back into the healthcare system, which is pretty remarkable. I think that's a very cool facet of what you guys are able to do.
Just really quick on that last point, bidirectional connectivity in our partners is a big part of what we do. So part of being their expanded care team, if you will, going into the home, we send a deluge of information back to the health plans and health systems that we're partnering with. And they count on us to help, again, be a part of that team and to provide visibility, right? And we're shining a light. You nailed it. Many people call that, the last mile problem, where people kind of disappear into the post-acute and into the home. That's where we spend the majority of our time, not making it a last mile problem, making it just, again, an integrated, connected part of the care continuum.
And I love that it's a human, like a human staffed one, as opposed to relying on a device. And I'm all for devices, but I think they have a role, and I think that there is a role that a person can actually play and add a lot of value with. So no. All right. So I have to know this then now. So deluge of information, please. Well funded now, what are you going to do with all of this money? I've got to scale up, right? We're going to prove value-based care can scale. And so what do you maybe have your eye on that some of my health tech entrepreneur friends might be interested in hearing? Is there any particular area of the business that you're looking to grow right away?
Yeah, absolutely. I would say we're planning to do two things. So first, we spend about $100 million a year in R&D today. So we have a big tech data and analytics component of our business, and it is absolutely our lifeblood. It is critical to how we run the business. It's critical to how we keep our networks of clinicians engaged. It's critical to how we report success, and it's critical how we get paid, right? Because those analytics show the results, and we get paid on those results. So that's foundational. We'll keep investing in that. We have a roadmap that's 5 years long, right? And we're so excited to be able to hire more people, bring more engineers in. And one of my favorite things, Jessica, because I came from outside of healthcare. I was a pure tech executive before. I love bringing great talent in from other industries that have a diverse perspective, a diverse background, and bringing them into really hard problems inside the healthcare arena. So that's number one.
Excited about that. Love it.
Yeah, no, it's fun. And it's great getting to see, people that we're getting people to click things all day or moving money around now come and see that they're making an impact with all the hard work that they're doing. It's transformational, and you can't go back. It's a wonderful feeling and something that I feel, frequently here at Signify.
All right. So number two, me.
Yeah. On the M&A side, we like tuck-in acquisitions, right? And so swing for the fence, big bang acquisitions, I don't think they're necessary. I don't think that it's not to say we'll never do one, But we're really looking forward to acquisitions. We have big customer contracts and drive a ton of value to them. And core to everything we do, again, it needs to be driving positive patient outcomes. And so I'm interested in getting closer to med management. I'm interested in getting closer to remote patient monitoring. Not companies that are leaving behind a tablet that never gets utilized inside the home, but folks that have really cracked via AI chatbots, intuitive new connected devices, and they're pushing chronic condition management to a new threshold, right? So we have a lot of interest there. A big part of our business, number 3, and then my final answer, is connected to the employer space. And so we are out now giving self-insured employers, like the state of Connecticut as an employer, guaranteed savings on chronic conditions and procedures, right? So we call that our commercial episodes program, right? Where we're getting employers and ASOs and health plans into the episode space, like we're doing already with the BPCIA program with the federal government. I want to be able to provide more visibility and deeper connectivity into those employers, right? And there's a ton of employers, and we need better channels and better access to sell and grow that part of the business. And I know there's a bunch of great tech and service companies that have figured that out. So we'll be spending time there looking for partnerships and other ways to kind of accelerate our growth.
All right. Well, that's exciting. And I think like employers, this is their year. Wow. I mean, and they've really, I think as a result of last year and having to deal with COVID and having to step up in a way that a lot of them, may have been headed in that direction, but more of them probably not. They have really embraced becoming health activist employers. That was the phrase that I heard too. I love that too. And I feel like it's great to see the industry, working to meet that group and to specifically tailor their services to their needs. So Kyle, congratulations again, buddy. It's so exciting to see another company in our health tech space, go public. I mean, our portfolio now may have like almost a dozen in it. Super awesome. Exciting. And congratulations on it. Any last thoughts from you on what people can expect from Signify Health this year?
Yeah, just more growth. We're going to be creating jobs, and we're excited about making an impact with our partners. We owe everything to our partners. They trust us to go in their members' homes, trust us to intersect into people's lives when they're having a very complex procedure. I mean, these are sensitive, critical moments that you can't kind of get it right. You've got to go in with eyes wide open and be a full service organization if you're going to really make an impact. And we're thrilled just at the trust that we're able to give. And I hope more than anything, other entrepreneurs see that it's possible to scale in health technology. And I want more competition because there's so much waste and so much opportunity in this country. I'm rooting for way more folks to come into this space, and I'm super appreciative of you. I listen to your show all the time, and I've learned a lot. So I'm thrilled to be on here, and thank you for the opportunity. It really means a lot.
Thank you so much. And on IPO day, yay! Go value-based care. I was so excited about this. This is great. Kyle Armbrester, the CEO of Signify Health, thank you so much for stopping by. It's a pleasure to dive into all of these things for you. Best of luck, in the coming months especially, and you'll have to come back and check in with us. So
happy to do it.
How you're doing, okay?
Yeah, thank you so much.
All right, awesome. Thank you so much. I'm Jess DaMassa. For more interviews with the who's who of health tech and healthcare innovation, be sure to subscribe to my YouTube channel. Just go to youtube.com/WTF Health. I'll talk to you guys soon. Thanks so much for joining us. Bye-bye.